Well, hello again. We are here for the second part of our webinar and is about Onda and Schwarzi, and we consider that a real breakthrough in the market of body reshaping. And this is thanks to DECA ongoing and relentless efforts in developing new systems, and thanks to the collaboration with a lot of engineers, physicists, and distributors, friends, and fellowship in the fellowships trainings. Well, this is the first slide with our clinic, where we are every day we have our daily practice, and this is the typical NP submental that Dr. Coli later will explain you. And this is my picture. And first of all, the mother of this platform, that is Federica. And thanks to her, we have developed this system over the last 3 years. Just few slides in a nutshell. I try to report back to you our experience and why we use. First, to stress the frequency, 2.45 gigahertz, allow us to be very selective for the fat, skipping the skin. Second, once we have reached the fat, we have a sort of intracellular heating generation with a thermal separation of triglycerides in fatty acid and glycerol with a compromised homeostasis. This leads to a sort of uncoupling between the two processes of oxidation and phosphorylation. Thanks to Professor Caligaro, we have the possibility to follow in the dynamic histological study what happens. This is the really significant image, quite fascinating, where we can see the chemotactic action of monocytes against interstitial extracellular lipids supplied by stressed adipocytes. And you see there is a first recognition of a free extracellular lipid drop from a single monocyte. You see the possibility to attack the lipid drops thanks to the signal that we release physiologically, that is called find me. And as a following, we have the process where we have the phagocytosis. The monocytes join one each other and becomes macrophages around the lipid drops, and then at the end they goes in the lymphatic systems and eliminated in the physiological systems. Well, these are our protocols about fat. There is even just the great capability to modify the old collagen in new collagen. Thanks to this action, we can improve on one side the cellulites, and the other side we have a tightening of the skin. This is very important in the submental treatment with the reduction of the fat. And we have another important consideration. The feature is to preserve with Onda the muscle. What we have, what DECA provides for the muscles, Schwarzi, so the electromagnetic stimulation of the muscle. We combine very often, but this is the part of Federica, so I give the floor to my collaborator. Thank you.
Okay, good morning, hello everyone. I really thank Professor Bona for introducing me and Alessandro for inviting me to this webinar. I think to know someone of you, so I say hello even to Shirin. Anyway, I introduce myself again. My name is Federica Coli. I work as a therapist here in Villa Donatello Clinic with my chief, my boss, Professor Bonan. And I normally deal with not invasive procedure. The main one I've been working with is Onda system. And I know that you know very well these technologies. So today we focus our attention on submental treatment. Submental treatment is a new area that we can treat in double chin area. This thanks even to these new handpieces. So probably you already have them. They are more ergonomic, lighter, and they guarantee a better coupling with the skin of our patient. So it's really easier to do a treatment with them. In particular with shallow one, I strongly recommend to use just this handpiece for treating double chin area for two reasons. One, because shallow handpiece has less penetration. So you know that double chin area is a very sensitive part. So we have many glands. So be careful not to work too deeper in the tissue. I remember you that we have only 7 mils penetration. So I strongly recommend to use it when you want to treat double chin area. Another reason is because it has a rounded cooling system part. So it's really easy to slide the handpiece in this very small area. Let's see where to move. So as I said before, we have many glands, many veins, many lymphatic vessels in this area. So be careful to move the handpiece only in this very small area that you see in green. So it's completely recommend not to pass over this red line where glands and lymphatic glands and vessels are. So please avoid to treat all this area. For this reason, I repeat again that it's strongly recommend to use the shallow handpiece because you see that the area is very small. So we need to do a very small movement, okay? So we cannot do a wider movement as in the body. Here again, we are seeing where is right to move. So we prefer to maintain the energy only in this small area. So more or less 1 centimeters below the lower mandible border. Be careful and remind that the handpiece has the cooling system and it has more or less 1 centimeters of diameter. So from this area, the energy cannot be able to deliver microwaves. So for example, from this video, you can see that my movement is a little bit wider. You see that I can go on the right, on the left, because I know that from the cooling system, I cannot able to transmit the energy. So you see that the patient is becoming red. This redness is due to the cooling system, not to the heat. And these are my parameters. So I normally deliver a dose between 70 and 90,000 joule, depending on my patient. So if I have a very lean patient with very little fat quantity, I prefer to maintain 70,000 joule. If I have a patient who has more fat, I increase the dose. Remember that for achieving good results, we need to increase the dose. For example, just yesterday, I treated a patient with a lot of fat on double chin area. So I decided to add some energy more at the end of the treatment. So at the beginning, I put 80,000 joule, but at the end, I decided to increase 20,000 more. So I gave to her 100,000 joule, but because she had enough fat. Power, I play with the power based on patient toleration. So if my patient can tolerate in a very good way, I can increase the power up to 80, 90 watt power. If the patient has very little fat quantity, it's better to decrease the power to let them tolerate better. These are some results. This is after 3 treatments. So you see that we treated just this little area. This is after 4 treatment. This is after 4 treatments again. And you see that even the skin quality improved a lot. My recommendation is to remain always in this little area, not to pass over this line because it could be dangerous, because the glands could swell up and the patient could feel discomfort sensation during the following day. This is after 2 treatments, so less treatment compared with the other patient that you saw before. Why? Because I increased the parameter for her. I delivered 90,000 joule of dose, and I worked with a power of 80 watt. Okay. I'm not able to change the picture. Sorry. Okay. Here again, the same patient. You see that I obtain loss of volume, but even the skin quality is totally changed. Even here from this clay picture, you can appreciate the skin quality improved. She's the same patient, side view in clay picture. Even for hair, I did just 2 treatments, and we obtained 70 cc loss of volume in double chin area. Surely she needs more, so I follow doing treatment for hair. Today, I have a patient for showing you the treatment. So I think we can move to the other room to start the treatment again. Okay, here I am with my patient. So it's the second treatment for hair. She has not much fat, but anyway, we can treat this area. Just to show you that even if I don't have much fat, I can do the treatment putting obviously the right parameters. So I always mark the area where I want to move. For sure here we cannot have a 15 by 15 centimeters area as in the body. So as I said before, we need to move in a very small area. I recommend to mark the area where to move, because it's not so easy to find the right area where the patient lays completely down. Okay? So I ask to my patient to lay down on the couch. Okay. I normally prefer to maintain my patient with the back a little bit tilted. So I tilt the back of my patient. Okay. Maybe too much. Okay. I set the machine. So I prefer, as I said before, to use the shallow handpiece for sure. I set, first of all, I want to set the dose. So remember that for having better results, we need to deliver as much dose as possible. So for her, she has not enough fat. Okay. So I decided to deliver about 80,000 joule, and I go down a little bit with the power. So I start with 80 watt power. If my patient can tolerate, I go on with these parameters. If my patient after some minutes starts complaining about the heat, I can go down with the power. Okay, so I'm gonna work for 70 minutes. I always maintain 5 degrees temperature to allow a patient to tolerate better. And I rub some Vaseline oil. I normally prefer to use a normal pen because you see that by using a pencil it can fade in very few seconds by using the oil, so a pen is better. I normally stay on the opposite side of the machine, of the device, so I stay here. Okay, the right position is this. I grab the end piece like this. I press the red button for starting the treatment, and I start moving on her double chin. So I don't do pressure on the tissue, but I simply slide the handpiece on the left, on the right. The speed of the movement can be slower if my patient can well tolerate. And remember that I'm using 80 watt, so she surely doesn't feel pain or heat for the moment, so I can go slower. But you see that the range of movement is very small. Never stay still, but always in motion. I cannot go here, here, or down. Always maintaining this treatment area. The redness that you are observing is due to the cooling system. Sometimes what I do is touching her skin on the sides just to feel if the temperature is increasing. Why on the sides? Because if I touch here, I can feel just the cold, just the effect of the cooling system. If you have any questions,
Federica,
see? Yes?
there is a question.
Okay.
The question comes from Shireen. She says, if patient has a tooth implant, is it possible they feel more pain? Or should we avoid the treatment for patients with tooth implants?
If the implants are in the mouth, there is no problem because we are not able to achieve the level of the implants. So absolutely no problem. Remember that we can achieve 7 mils penetration with this handpiece, so no problem with the implants. Same answer even on the body. Remember that we are not able to reach the level or where implants are. But I know because she did these questions, because when we use, for example, radiofrequency on the face, implants are a problem. So I perfectly understood Shireen's question. But no, anyway, no problem with Onda. If you see, for not stressing my arm and my wrist, I always dance with my body. Prova a prendermi un po' più da lontano.
So you see, okay, now my patient feels heat, so I cool down the skin, I stop the energy, and I'm passing just the cooling system, and I start again. Okay, I was saying that I normally move my body, and I maintain my arm still, just not to stress the arm, the shoulder, and my wrist. I do this even for body treatment. Okay, I have 12 minutes to go, so probably I should decrease the power for her because she has not much fat, so probably she needs 70 watt. I try to follow doing the treatment like this, but probably we need to decrease it. Dimmi se... Cosa senti ora? Okay. She's feeling the heat, so I decided to stop, to go down with the power. I give time to the cameraman to move. Okay, I decided to go down here. 70 watt. And I cool down the skin of my patient for a few seconds. I rub some Vaseline oil more for better sliding. And I start again the treatment. So you see that I always decided the parameters for my patient, but during the treatment I can change my mind. So I always ask to my patient if she's fine, if she can tolerate, if she's feeling too much heat. Based on her answers, I can decide to play with the parameters. But I never touch the dose. I want to finish the dose. I can play with the power, decreasing or increasing it. Meglio?
Perfetto.
Now he's perfect, she's saying. I'm feeling with my fingers that her skin is warm, just warm. The results will be visible even in the surrounding area here in this line where I cannot pass on it, but thanks to the heat diffusion, I'm going to see a very good improvement even in this profile. And I asked to Joanna if she can bring me the thermometer for taking temperature of my patient. It is in my room. Okay, Patrizia? Okay, now she can perfectly tolerate. So you see that it's very easy by fixing the power, your patient can easily tolerate. Thank you. Other questions? You see that this is interesting. You see that the redness is more visible on the sides and not in the middle, because here in the central part I always cool down the skin, while in the external part I have a heat diffusion, so the temperature is increasing. I normally do the following treatment after 3 weeks, 3 or 4 weeks. As in body treatment, we prefer to wait this interval time for giving time to lymphatic system to remove all the scraps. And a draining massage is strongly recommended. For example, a lymphatic massage, a water massage on the face, on the neck. It could be good for helping the draining mechanism. You can wait even just 3 weeks, not 4, because remember that we are delivering very low parameters compared to the body. So 3 weeks could be enough. And if you have any doubts, even in body treatment, you can share with me your doubts, and I can help you to understand better how to perform the treatment. Okay, Patrizia? Mm-hmm. You see that with this new handpiece, the light is always green. So it's nearly impossible to lose the contact with the skin, even thanks to the rounded cooling system here that they did. So it's very easy to stay in contact with the patient compared with the older one. Going on with the treatments, with the path, probably in the future, I will decrease the power and even the dose. because probably she's going to have less fat. So it makes sense that I should decrease dose and power. Okay, 5 minutes to go. Tutto bene, Patrizia?
Perfetto, c'è una mano qua leggerissima. Sta benissimo. Va bene come sto?
Perfetto.
Ok. Dimmela perché io cerco di... C'è tutta impicciolita.
Okay, one thing more is another suggestion that I can share with you is in order to have more results, at the end of the session, if my patient can tolerate more, I normally add some energy more. So for example, for hair, I put 80,000 joule of dose. If she's fine, I can add, for example, 20,000 more in order to have more results. But just in case my patient can tolerate and she's fine and she doesn't have discomfort feelings or pain sensation. They normally tolerate very well in this area. It's a relaxing area to treat, very comfortable for the patient. If you are using Onda for body treatment, you exactly know that when we are about to finish, we normally go a little bit faster because patient feels a strong heat sensation at the end of the treatment. While in this area, I can go slower because we are using a very low dose, a very low power. So patient can perfectly tolerate even if I go slower. One minute to go.
Erika,
Yes?
another question, and the question is probably relevant to what you have just said regarding increasing the power for this treatment. So
Power or dose?
power.
Mhm.
You can maybe describe when you can increase the power, when you want to increase the power.
Okay. No, as I said before, the most important parameter is the dose, not the power. So the power essentially is the strength, the speed that I use for pushing down all this energy. But the most important parameter is the dose. For having results, we need to increase the dose, not the power. Okay? Obviously that I prefer to increase even the power to spend less time for doing the treatment. But for having results, I need to increase the dose. For example, I do an example now. Now she's fine. She could tolerate a little bit more. So what I do is, okay, I know that I have already delivered, 80,000 joule. So I press the arrow up and I see that I have already delivered 80,000 joule. Now she's fine, she can tolerate more. So what I do is to add some energy more in order to have much results. So for example, I decided to increase 20,000 more. It means that at the end, I delivered 100. But I don't touch the power because I have already seen that she can tolerate this kind of power. So it doesn't make sense to increase because I know that in few seconds she will complain. So I maintain the same power, but I can add some dose. Okay, now is slowly decreasing, 38.7. So on this area we can achieve 39. Sometimes even 40, but when I have more fat than in this case. Because when I have more fat, I can even increase power. Okay. So I thank for your attention for this double chin treatment, and now we move to Schwartzy presentation.